I don't know how many things we can say that Janine's taken care of in terms of the infrastructure and enabling, and really having a lot of negotiation around, how does the province and Ontario Health support these teams?
Speak specifically to the procurement, although I think Gaia brought up some of the challenges that we saw throughout the procurement, right? With OHTs have close partnerships with SPOs, and then all of a sudden we had communications blackout, and they couldn't collaborate with them in the way that they're used to working with their partners. But I will just say that what will be interesting to learn, Walter, is because of the new pricing model, the capitated payment model with stop loss, that's kind of innovative. And it was based on baseline data from home and community care, was how it was developed. So we'll have to see over time how that plays out in terms of, was that data accurate enough to inform that modeling? So I think that's going to be interesting to track over time. And we have a new quality and performance schedule. So the SPOs will be sort of working with their OHTs in the first 6 months to track certain measures. Some of them are related to your patient experience questions. So we tried to overlap where possible, where we're already collecting up data that could also be used to inform quality. So that was really nice to work with Kaylee on that. And there'll be an earn back model. So the vendors will receive an incentive, or the teams will receive a credit based on their performance. There's a lot of caveats around it, the measurement and having the right end number and whatnot, but I'm interested to see how that works out. Overall, we learned a lot through the procurement, like procurement team learned a lot, and we came up with some specific recommendations that have gone to internal partners at OH and Ontario Health at Home who are looking at the future of contracting in the province. Like, we had some lessons learned around, understanding the job market, communicating with the vendors, vendor development, and the timing for the procurement. But overall, I found the process, even though it was very difficult for the OHTs in their relationship building with the SPOs, working with them on the scope and requirements for the procurement was amazing. Everybody was super collaborative. So I think using that approach was good and was helpful, to have the end users of the product involved in determining, what are the things we're looking for and what the SPOs will be offering in these innovative models.